My friend, who's very smart, read Diet for New American, said, I'm never having beef or chicken again. But he continues to eat fish and dairy. What do you need to say to him? In other words, he's only interested, like, what's the problem if he eats, what's going to happen in his life differently if he was eating beans and quinoa and beans and grains versus eating fish and cheese, fish and dairy? Well, what's going to happen in his life differently health-wise because on a regular basis he eats fish and dairy as opposed to if he was eating a whole food plant-based diet?
I think I have to say something about the dairy thing, growing up milking cows, but if that's what you're referring to. Yeah, I found it a little bit difficult to digest the information I was getting, no pun intended. But the question concerning dairy, especially because it's valued calcium and it's valued protein, if you will, the data really show very clearly that that's problematic, pretty seriously problematic. I don't know, I fall back, I guess, on cliches of one sort or another. The dairy is just simply, the data are not there to support the consumption of dairy. And I'd really like to emphasize on that point the role of feeding our children. One of the specific things I have in mind is the fact that the U.S. dietary guidelines, in part, but more to the point, the school lunch program is such that for schools to participate in that, they're required to at least offer the dairy option. I've found that troubling because that, in that case, is a marketing ploy as far as I'm concerned. It's not a health food, and it really locks in children at a very young age to get started. So I don't know, I'm kind of dancing around your question, Steve, but the data for me, having been on both sides of the fence on that one, is very persuasive. The dairy is, I often say when people ask me, what should I drop first? I usually say dairy, because I think it is problematic in many different ways, starting out with the children especially. I don't know whether.
Yep, that's great, thank you.
Colin and I share a little bit of background. I could milk a cow by the time I was 4 years old, too. We were dairy farmers for many generations in Michigan. And we still have a family farm there, owned by my cousin now. But I think I would, in responding to your question about your friend, maybe I think go down the path that Pam describes, and not necessarily say that you need to give up dairy completely forever. There's lots of evidence that replacing dairy with some healthy plant-based protein sources like nuts and legumes and soy products will randomize trials showing it will improve your blood lipids. We have long-term epidemiologic studies showing that it will be related to lower risk of cardiovascular disease. And also, your bones are not going to fall apart. Colin's right, you don't need to have large amounts of dairy. We do need some calcium, and for people who are really not getting it for other reasons, getting from other sources, a small amount of dairy could fill in some nutritional gaps. So I think an alternative, or one way to go, is to say, there's lots of evidence, and I can help point you to some of that if you want it, but that these changes, and whenever we talk about reducing something, it is really important to describe what we would use to replace it, because if we replace it with Coca-Cola and other high sugary sources, of course that's not going to be better, could even be worse than dairy. But cutting down to one serving of dairy a day would probably be a huge step forward. And actually, fish has some positive nutritional value too, and I think for most people it's good to have fish once or twice a week. Otherwise they may not be getting optimal amounts of omega-3 fatty acids, so it's not necessarily giving that up either. If that person decides they want to become a strict vegan, well, that's also okay, but they're going to have to pay some attention to sources of vitamin B12. But again, we don't have to make one huge step altogether, going down a path, and that's what we see in our studies, that the farther you go down that path toward a healthy, whole food, plant-based diet, the better it's getting. Every step in that direction is better. But when you start to get down to really the difference between vegan and somebody who's having fish a couple times a week, in fact, what data we have say that the pescatarian actually looks a little bit better, but we really don't have data to make a sharp distinction between those two kinds of diets.
I love it when patients.
I'm sorry.
I love it when patients come in and are using dairy products, because I know that that's the single biggest factor that we can change that's likely to have short-term benefit in their life, whether it's their joint pain, their sinus congestion, their bowel disruptions, their obesity. Eliminating dairy, and particularly cheese and some of the other highly processed dairy food products, have the biggest short-term benefit to people in terms of what their direct experience is. So I'm glad to hear people that are suffering are including dairy, because I know I have a quick fix that will have a powerful impact on them.
I was inclined to reaffirm Walter's perspective. Alan, you just mentioned highly processed dairy. So one of the things I was going to say is what dairy and what fish, and what are the ancillary considerations, and what's the dose? So the idea that you can't eat any of this if you want to live long and prosper is rather belied by the fact that 4 of 5 blue zones around the world, you're all familiar with the blue zones where people routinely live to be 100, don't get chronic disease. 4 of 5 are omnivorous. The only one that potentially is not is the Seventh-day Adventists in California, and a lot of them are vegetarian, so there's dairy there too. The vegans may do better than the vegetarians, but 4 of 5 are certainly omnivores. And dairy is a part of the diet in the 2 Mediterranean cultures that figure among the blue zones, the Sardinians and the Icarians. But that doesn't mean dairy is the reason they're living to be 100. Maybe they're living to be 100 despite the dairy. Or maybe it's because it's locally sourced, organic, grass-fed, no hormones, no antibiotics, all that good stuff. Maybe it's because the dose is very limited. So, I think the critical point here is that if you massively shift the diet in the direction of plant predominance, whole foods, minimally processed, all that good stuff, there may not be as precise a definition of the one way to live long and prosper as our ideologies might make us favor. But then there are other considerations. How are we treating animals? How are we impacting the environment? I've heard colleagues say, for example, that fish is toxic. Eating fish is toxic. Well, it certainly is for the fish. Most of the epidemiology would suggest it's beneficial to people, but compared to what? Keep in mind that when we talk about the health effects of isolated foods in the United States, usually the background for comparison is the stuff most people are eating. And the stuff most people are eating in the US is the seafood diet. I see food and I eat it, whatever the heck it is, even if it glows in the dark. Almost any real food is better than that. So yeah, fish looks good, but would fish look good if you were introducing it against a backdrop of an optimal plant-exclusive diet where the only way to fit fish in your diet is to bump out some beans and to bump out legumes? Well, we don't know. That study could conceivably be done. I've not seen such a study done. Optimal plant exclusive versus that plus a little fish and then maybe adjust the dose. So I think if we are going to stick with science, which is something that Essie asked us to do here and emphasize that, we have to be honest with you about the data gaps. Is the addition of some amount of sustainable fish good or bad against the backdrop of an already optimized plant-predominant diet? I don't think we have data to answer that. Will some small amount of locally sourced dairy preclude you from living to be 100 free of chronic disease, your friend? No, because they're doing that in Ikaria, Greece, they're doing that in Sardinia, Italy. Maybe they're doing it despite the fact that they eat dairy. Maybe dairy is making some small beneficial contribution. But what's pretty clear is wherever people are living long and prospering with vitality, diet is mostly plant-based, And so dairy occupies a very small niche. And again, I think fish may be a somewhat more complicated topic in terms of the health effects for us, but we're depleting the ocean. So again, my fallback position is eating fish may be good for people, may be bad for people. It's bad for the fish.
I would be with.
Go ahead.
Just one thing I want to add to this. I would be with Dr. Goldhamer for getting rid of the dairy because I think it is the low-hanging fruit to help people get better quickly. The mitigating factor with the blue zones that I think we have to take into consideration is there's a difference between somebody who grows up in Icarus, Greece, lives in a cloistered environment, eats an optimal diet from the very moment they enter the world, breastfed, good food, fresh food, and what can be in a diet when life starts that way, versus the types of people who are ending up in our office who did not start life that way. That's what you see in your practice, Dr. Esselstyn. So I think that's a mitigating factor that has to be taken into consideration, that if you lived in Sardinia your whole life and your diet was perfect from the get-go, but included some dairy and that sort of thing, you probably can get away with it. But that's not our patient base, right?
Yeah, I think there's some fascinating parts of this discussion. I think we always have to, at least as physicians, we have to distinguish whether we are advising people who are well what they should eat and people who are sick, how we can alter their diet and actually restore their health. In my particular practice with patients who are all sick with triple vessel coronary artery disease, I play hardball. I don't want them to have one single morsel pass their lips that is going to further endanger their endothelium and its capacity to make nitric oxide. And we've shown time and again, when they do this, we can halt the disease, and we often get reversal. But the point I want to make about wellness is I've been out on the circuit with this now for more years than I'd like to remember. It's possible that that I'm beginning to be haunted somewhat by the fact that almost invariably in the audience that I'm facing, there are going to be persons who are sick that I'm addressing, and then there are going to be those that are well. And it's been haunting me more and more in the last year or two that really, who are the people who are sick? They were all the previously well. How did they get sick? By eating the foods that injured them. And some of those people took enough of those foods to injure them to the point where they got sick. I'm reminded of a study several years ago of 905,000 patient years of follow-up. And what happened in that particular subset that I was fascinated with were the men and women who were 55 years of age. And they had absolutely optimal risk factors. Their weight, their blood pressure, their cholesterol, everything was fine. And they followed them for 30 years. At age 85 now, 30% of the women and 40% of the men had now developed cardiovascular disease. So I think that we have to kind of think carefully about those who are well today and what is the message that we want to give them to maintain them in that state.
So, I work with a lot of patients that have autoimmune disease, and you turn on and off their symptoms, sometimes with a single dairy meal. I mean, they'll tell you because they'll inadvertently get exposed to something, and that one meal is enough to activate their symptoms. So as far as dairy products are concerned, I think your friend's experience is going to be pretty obvious. Most patients that stop using dairy products don't come back and say, oh, that wasn't worth the trouble, because they can notice it when they do go back and have the occasional exposure, if they happen to be sensitive, as many autoimmune patients and other ill patients are. They can tell themselves very, very quickly. I don't have that same experience, for example, with fish exposure. You know, it doesn't have apparently the same type of antigenic response. Those people can eat it, they may or may not notice. But with dairy products, I feel really strongly that the patient experience himself, if you can just get him to stop it for a week or two, They themselves can tell whether or not this is a health-promoting food or not.